Hello, my name is Jeff Peterson. In our previous post, we talked about the nature of pain. Today, I want to give you some tips on what you can do to deal with your pain. And we talked about particularly coming out of lockdown from the COVID-19 and the virus that everybody's been experiencing, been impacted by that. One of the things that I've done over the years is I like to adopt a theme, and it helps me simplify life. So the theme that we adopted here at Peterson Physical Therapy during all of this is that we are going to choose peace over panic, we're going to choose faith over fear, and we're going to look for opportunities to be kind to those around us. So we've been really practicing those. My personal life vision is to know myself, control myself, and give of myself. And those are consistent. So I thought, how can I be helpful to those that are in a similar position to me? And I thought, I'm going to rely upon what I've always done. So the first step that I believe that one can do to deal with pain that you might have related to inactivity or even an injury is to really know yourself. So know where you hurt. So think about, okay, where do I hurt and what's the intensity of it? All pain is not the same. The other thing that's important to understand is to know the quality of the pain and when it hurts. What position are you in? Too often we have patients come in and say, well, when does it hurt? I don't know. It just always hurts and it's always the same. Well, pain always has a pattern. We may not be able to identify the pattern. And if you can't, obviously you come and see us and we help you identify that pattern. But identifying where the pain is, the intensity and the quality of it, but also the time of day and what positions. And if I have pain in my shoulder, if I move it more, does that increase the pain or decrease the pain? So trying to just have some understanding of the nature of your pain can be really helpful. And that information can be helpful when you go see a physician or a physical therapist. So that's the first thing, would be to know yourself. The second thing would be to have some measure of control. So with the control, now one of the things that adds stress to us is when we try to control that which we have no control, or we don't take control over that which we do have control. So in this whole idea of COVID, one of the things we have control over is, do I keep my hands clean? Do I keep my hands off my face? Do I recognize those that might be sick? I don't personally believe that we can treat everybody like they're infected and live under universal precautions, but there are some obvious things we can do. And like I said, that's practice good hand hygiene, wash your hands regularly. That's something you should do all the time. There's a lot of other stuff out there besides viruses that you can pick up from hand contact. Wearing a mask, that's a controversial issue. I would never mask shame anybody. I don't want to virtue signal about the mask issue. But what I would say is if you're around someone who is sick, they're elderly, or they're a vulnerable population, by all means wear a mask. If you yourself are sick, then you can wear a mask. And then the other things you can do is make sure you're eating well, that you're limiting your consumption of things that are not good for you, and that you're getting some exercise, particularly getting outside in the fresh air. That's always been shown to help you physically and emotionally. And if you can stay emotionally and physically healthy, that's a good thing. And then the last thing is to give of yourself. So our theme at work has been to look for opportunities to be kind. My personal theme is to look for opportunities to give of myself. Years ago, one of my mentors said, one of the best ways to combat depression or being down emotionally is to look to serve somebody else. And it doesn't have to be a big thing. You don't have to go do a mission trip in Africa. It can be something as simple as holding the door for somebody, offering a kind word to someone who's serving you either at a grocery store, at a restaurant, overlooking small irritants that you might want to confront. Those type of things, if you can frame those as I'm going to choose to be kind and give of myself, you will be amazed at how that can lift your spirits and help you feel emotionally stronger. And those are the kind of things that help you be strong. When I deal with patients, people who come in who have some sense of self-awareness, who have some measure of the ability to control what they can and the ability to let go of what they can't, and then also the attitude of they're willing to give of themselves even to the process of the physical therapy, those are the people that have the greatest amount of success in dealing with their physical pain. So I would encourage you to think about those things. If you can think of there is many other issues around giving of yourself and self-control that I'm totally open to having you include some comments We like to learn from everybody. And then feel free to like our Facebook page and subscribe to our YouTube channel. So I hope this was helpful.